making the case for Resume.
What is Resume? So it's water vapor therapy. Involves the delivery of thermal energy via steam transurethrially directly into the prostate tissue.
This leads to cell disruption, tissue necrosis, and subsequent resorption, and therefore reduction in the size of the prostate, and subsequently symptom improvement. The number of injections given depends on the prostate size and the length of the prostatic urethra, and the indications are sort of men 50 or above with moderate to severe LUTs. In the studies, and in the recommendations, they've used the size of 30 to 80 cc, but I'm sure you will hear that in certain clinical scenarios that indication can be amended, and more importantly, you can treat the median lobe. So I'm sure you're already sold, but let's go on. The question is, does it work? So in the original studies where Resume treatment has been compared with sham studies, they found that not only did sexual function get preserved, but also there was symptom improvement, and these improvements were sustained at 1 year. The same group have looked at that data at 2 years, at 4 years, and finally at 5 years. So we know that through to 5 years, you have a good improvement in IPSS, in flow, in BPH scores, and also the retreatment rate is quite low, 4.4% retreatment rate at 5 years. I think that's quite impressive. Looking at UK data, we know that in a single center experience where they've done quite a lot of these procedures, again, their results mimicked those of the non-UK studies, which showed that there is a sustained improvement in symptom scores across the board. And in a study where, not actually highlighted here, but they compared Resume to the drugs, so is Resume better than the drugs? So they used the data from the MTOPS trial where they looked at sort of monotherapy with alpha blockers or with finasteride, and also with combination. They found that a single Resume treatment was better than monotherapy for those medications and similar to combination treatment. But who actually wants to be on all those medications for years when you can just have one steam injection treatment? Final remarks: Resume practically short learning curve can be done in the outpatient setting, which is very relevant for UK practice. We don't have theatre space. We want procedures that can be done in outpatients, and we want patients to be able to go home the same day, knowing that we've done a good job for them, and they will have a sustained improvement in symptoms. Importantly, patients with a median lobe are not excluded from being able to benefit from Resume, and you don't have any retained foreign material that's in the prostate, which obviously is a plus. And patients, of course, are discharged with a catheter for a few days. There are some contraindications, so patients with an active UTI or patients with penile prosthesis or AUSs, and also those actively anticoagulated cannot have it. But essentially, you've got a treatment that can be given to a good range of our patients in an outpatient setting, so I'm sure the GERDs, people will be happy with that. And we know from the data that they have good symptom improvement that is sustained over time. Should we end this talk now? Thank you very much.